So good day, Miss Xouris. Am I pronouncing that correctly?
You are.
Yes, welcome. Thank you for joining us from New York Presbyterian. I know that I want to introduce you as the clinical director of the Cancer Care Services there in Queens. And so just please tell us a little bit about what you offer there.
Absolutely. Hello, everyone. So my name is Jacqueline Xouris, and I'm the clinical director for the New York State Cancer Services Program. The New York State Cancer Services Program is a program specifically for uninsured men and women living in New York State. I manage the program here at New York Presbyterian Queens for the entire borough of Queens. So we provide linkage for anyone who calls our number 718-670-1561. That's our office here, and we link any uninsured man or woman to cancer screening services across our borough. We do it here at New York Presbyterian Queens. We offer free mammography, cervical cancer screening, and colon cancer screening. This being October and Cancer Awareness Month, it's really important to remember that mammograms save lives. We encourage everyone to get their annual mammogram, and lack of insurance should not be a deterrent. So this program is really phenomenal for those of us that may be between jobs, don't have insurance, perhaps lost insurance through COVID. Number of reasons why so many people in our borough don't have insurance. Many are working long hours, but part-time jobs, multiple jobs that don't offer insurance. And New York Presbyterian Queens is here to help you. So we encourage you to call our number and schedule your appointment. We will link you to a mammogram or a pap smear or colon cancer screening. And this program covers everything from the initial screening exam, be it your clinical breast exam with a provider, to your mammogram, and any additional imaging or services that may be needed. Many times women have a finding on their mammography that requires an additional view. Sometimes they have to have a breast sonogram. Sometimes they have to go on for surgical consultation and speak with a doctor about findings and even a biopsy. Any of those services are covered at no cost to the patient here at New York Presbyterian Queens for the uninsured woman. So we are determined to reduce late-stage breast cancer diagnosis and mortality across our borough, and particularly in women of color. Really, the rates of mortality and late-stage diagnosis are much higher than the Caucasian women, and that shouldn't be. And here at New York Presbyterian Queens, we are working to eliminate barriers such as lack of access or lack of insurance. So this program is wonderful, and I hope to have your call, 670-1561.
So I just had two quick questions. One, typically how far in advance would someone have to call and expect then to have an appointment with you?
Sure.
And the second would be, well, let me let you answer that first.
Yeah, so eligibility for our program is not having had a mammogram in the last year. We encourage women to get their mammogram every year. We also think it's important that women go back to the physician or the provider where they had their mammogram, or at least get their films so that we can compare the mammograms from one year to another for subtle changes. So we work with you to do that. If you were to call today for an appointment, we could schedule as early, within 2 weeks. If a woman has a palpable finding or something they're really concerned about in their breast, we can get you in even sooner. And those women, they require initially a diagnostic mammogram, a little bit different than a screening mammogram. Diagnostic mammogram means that the doctor's there at the time of the mammogram to look at those films right away in case anything additional is needed. But yeah, we really have accessibility and open appointments.
Okay, and the second question was, I don't know if you mentioned it, is there an age where this is allowed, is minimum age, or when people can make the appointment?
Yeah, so the majority of women at risk or at our greatest risk is as we age, right? So this program is open to any woman 40 and over for breast and cervical cancer screening. The average woman, the healthy woman, the woman with no history. However, there are exceptions. If there is a younger woman who has a palpable mass, or a younger woman who has a strong family history of breast cancer, or a young woman that knows she carries the mutation to the BRCA1 or BRCA2 gene, those women can be enrolled in our program. Eligibility is based on a one-on-one conversation with us to determine that eligibility based on personal risk.
Wonderful. Well, I
want to just say colon cancer, the guidelines have changed now, and we encourage everyone at age 45 to start colon cancer screening. Those of you with a colon cancer history need to start earlier. Colon cancer is the only cancer preventable. We're very big here at New York Presbyterian Queens on getting the word out that colon cancer is preventable. So, take a fit kit, have a colonoscopy, let us help you.
Okay. I know it's rare, but for men, and as far as screenings, what type? I know that sometimes men have breast cancer.
Yes.
And so what are the policies there surrounding that?
Great question. Yes, we have to remember the men in our lives. Men are at risk for breast cancer as well, although, as you said, at a much lower rate. Any gentleman to be enrolled in our program would have to be symptomatic. So they found a lump in the shower. The difference with the women eligibility is we want healthy women to come in and we screen them, right, every year. But for the man, it would be that he found a lump in his breast, or he is a BRCA, has the mutation to the BRCA1 or BRCA gene in his family, or is a known carrier of that mutation. Those men, again, would be determined eligibility one-on-one, but we absolutely do offer mammography for symptomatic men.
Wonderful. So if you would just share again your telephone number, and so that everyone knows.
One other thing I want to say is that we do have patient navigators that assist with specific targeted populations across our borough. So we do have a call line for our Latino patients. Women who only speak Spanish can call 718-670-1604. Those that speak English may call 718-670-1561. Chinese speaking patients, we have a call line for that as well, 718-670-2918.
Yeah, you read my mind. I was about to say, are there any other translatable lines available?
Yes.
Yeah, that's great. Wonderful. So we will definitely spread this information throughout our district. We thank you.
Oh, you're very welcome. I hope you had your mammogram this year.
Yes, I did just last month. So
okay, wonderful. Yes. Wonderful. That's the best thing we can do for each other. Encourage the women you love to get their mammograms.
All right. Thank you. Have a great day.
Bye-bye.
Bye-bye.